Right, let's get into that interview now with the Health Minister, Dr. Zweli Mkhize. He has, of course, expressed confidence that the delivery of the country's vaccines is on track. This despite the Health Department not meeting its target of vaccinating at least 1.5 million health workers by the end of April. Mkhize recently appeared before Parliament's Health Committee to give a two-weekly briefing on the progress of the country's COVID-19 vaccination program. Meanwhile, the country has recorded 22 new COVID-19 cases in the latest reporting cycle, which increases the cumulative number of cases in the country to 1,548,157. And the number of deaths recorded in the country is also up to 52,846. And active cases currently stands at 20,992. That's just the statistics. So let's get a little bit more from the Minister on the vaccination plan and other issues. Hopefully we can hear each other and all is good. Our Health Minister, Dr. Zweli Mkhize, good morning to you. Oh, I'm so glad we've got you. It's good to see you and looking forward to the conversation. Minister, let's focus right up front on the vaccination process, because this is where a lot of South Africans are concerned. We need some detail. So can you give us some details as to when vaccines will be arriving for that rollout here in South Africa? How is this process going to go?
Thank you very much, Leanne. We are expecting the vaccines to come in April. Each time we discuss with all the manufacturers, they would give you the 3rd and 4th week of April to say by that time they would have been able to deliver, and they are trying to deliver for earlier. They don't tend to commit to earlier dates, and that's really what we have seen now. And so we're expecting that 1 million vaccines will come from Johnson & Johnson by April, and then for each of the 3 months of the following months, there'll be just about 0.9 million in May and another one in June. Then the numbers will start increasing beyond that from July onwards. And so we believe that the Johnson & Johnson consignment should be coming around that time. Then we haven't got a concrete date from the Pfizer, but we're expecting that Pfizer should give us about 5.5 million for the Q2, which is from April to June. And we also got a notification there'll be an additional 1.25 million from the COVAX facility. And so that is how we're going to be receiving the vaccine.
Yeah. So I had a little bit of trouble hearing you in the beginning. I hope everybody managed to hear that. But you were saying, so we're expecting 1 million Johnson & Johnson to arrive in April. So that's next month. Is this still part of the trial? Is that still going to be administered to the healthcare workers?
The delay in the Pfizer consignment means that we still have to do additional vaccination to the health workers. So we would obviously like to do with Pfizer, but we will see how it comes out. But everyone else, after that, is going to be going through the normal plan for vaccination, which is what we had planned, and therefore it's a full vaccination program. But when Pfizer comes, the Pfizer vaccines come, we'll need to do a short trial as well, which is a real observation study. But it doesn't mean that we're doing the same thing that was done on the trials last year. It's just an observation, just to be able to see, are we picking up any breakthrough infections? Now, this is important for us so that we know what to anticipate in the following few months.
Yeah. So, Minister, the date now, this is important information, I think. When we look at because we keep missing the deadlines, when now are we hoping to finish with healthcare workers? Which at the end of April? Is that still the deadline, that we can now finish healthcare workers and those that are working on the front line?
If we go strictly on the basis of our original plan, we had said that the phase 1 should take us 3 months. Now we go back and say we started phase 1 on the 17th of February, and therefore it should be 17th of May that we get to the end of that first phase.
Okay.
So we then said that we expect that there may be more vaccines coming. So even before we finish the first phase, we'll also start with the second phase as soon as those vaccines come.
Yeah.
So there'll be an overlap. So the health workers remain our priority for phase one. So the first few vaccines that come will actually be used to finish off with the health workers.
Okay.
But yes.
So, Minister, just with all due respect, and I'd like to get a little bit more clarity on this, we call this phase one of our vaccination rollout. There are so many differing views as to whether this is in fact phase one of our vaccination rollout, because this forms trial of this is forming part of the trial of Johnson & Johnson, of them sending when they can and if they can. But it's not necessarily the start of the government full rollout, and everybody says that, be patient, when it starts it'll be bigger, but you're saying that this is in fact phase one of our rollout. So let's get some clarity. People are saying we haven't even started with a rollout, but you're saying yes, this is phase one.
Let me just explain a little bit what's happening here. We needed to start with the rollout of the vaccines. So we wanted to start in February, and we did. But how did we start? We started by saying that there were two things to take into account. The first issue was that the only available vaccines from Johnson & Johnson were those which had been earmarked for the trials, which then meant that we can only take them if we will then be registering them as a trial. But we needed that study because for the previous results that we have seen, we just want to make sure that we have implementation studies that show what happens when you've started the proper implementation. So the trial was registered for two reasons. One was that that's the only way you can get access to vaccines which are fully functional, safe and efficacious, but which are available at the time, because Johnson & Johnson only starts releasing from the manufactured batches only in April for the whole world. So if we wanted to start with Johnson & Johnson vaccine, we couldn't start with the vaccine that would have come from any of the manufactured lines, because they're only going to release them next month. So no one really had those vaccines, except that we wanted to start early. So we then said we will take those that were earmarked for the studies and do that, because in any case, we do want to have a sense of an observation once our vaccination is started. Now, when we get the Pfizer, for example, we will find that Pfizer has done all the studies and everything, but we also want to have a sense, like in Johnson & Johnson, what to expect when you've done for more people. Like in this case, we want to do 500,000 on Johnson & Johnson. We could do a similar amount on the Pfizer. We're busy discussing that issue. In this case, it's also called, they call it a post-market surveillance, which means you are on a full rollout, but you must do some observations to just make sure you know what to expect as the process goes on. So yes, it is a study in the form that we are making certain observations, but it's actually part of our rollout, because our rollout, the difference between the studies that were done before last year is that people didn't know what they were getting. If you got two people given an injection, they didn't know whether it was a placebo, whether it was a real vaccine. So that is really what we call a double-blind trial. This is what has been done with all the vaccines. We're not doing that now. Now we're giving people the exact vaccine, which means once we've given the individual, we won't have to do another one afterwards. Whereas on those who were on the trials before, they don't know what they got. So they will only they'll have to be vaccinated on the basis that whatever they were injected with could have been placebo, could have been a proper vaccine. Yeah. Here we know we're giving people a vaccine and will not go back to them again.
Okay. All right. Minister, I'll fire a couple of questions at you. A lot of viewers have been writing in, and this is the perfect opportunity to get some answers. So one of the questions coming through, actually not one, quite a few of them, is about the slow pace. And when we look at different countries and we see at the rate at which that they are vaccinating the citizens of that country, I mean, they far surpass us, and we are, they're days where we don't even administer one single vaccine, and then suddenly there are a few more, and then nothing, and we keep waiting and waiting and waiting and getting promises. So there has been a great lot of concern about how slow this is, and maybe even calling this a disaster. Can we speak to that?
Okay, let's first get back to the basics. We said that the first phase will take us 3 months, and it hasn't finished 3 months. We wanted to vaccinate 1.5 million people quickly, and we bought the vaccine, and it was called AstraZeneca. We were ready to start, but then there's a trial, and there was a result came that indicated that those vaccines don't have as much efficacy as we expected. They would drop down to about 10 to 22%, and therefore our advice was, let's not give that, because our variant in South Africa is different. Even though WHO has said with the other variants, they can give the AstraZeneca vaccine. We know that in Brazil and in the UK, their variants there that they have were sensitive to people who are immunized with AstraZeneca, not in South Africa. So we didn't have enough information to actually can say ethically it's correct to give people something like that when in fact you have other alternatives. So that was the issue. So we did have all those vaccines ready, and everybody knows about them because people actually started talking about expiry date and so on. So the issue is that the vaccines were there, we were ready, we would have actually been able to finish the vaccination at that time. Because we now had to change to Johnson & Johnson, we now had to get the stock that had to be recalled from various countries. The recalling, the relabeling is taking a bit of time, and that is what has happened. But we are still within the 3 months. So the slowness is relative to the fact that we already had 1.5 million that was committed for immediate administration at the time. That is when the target of 1.5 million quickly was going to actually be achieved. But now we've had to dispose of all of those vaccines. Now these vaccines are coming slower because they have to recall from different countries, get relabeled, and so on. We still have the commitment for 500,000 of those, and that we should continue in the next 2 weeks. We should be able to complete that process. Now, we have got formal approval of all of that. So that's really what has happened. The one that we also expected should have come a little bit earlier is Pfizer. Even as early as this morning, we were talking to Pfizer, they actually do delay quite a bit, and therefore everything is finalized with them, except we need to now sign the agreement, but we know we've got a commitment of 20 million doses, 5 million of which will be arriving in April, and so all of that is fine. That's just the process. We expect them as soon as possible to be now dispatching their first batches to us. So that is what is the nature of this thing. But we have said 3 months for the first phase. We have not finished 3 months. We wanted to do 1.5 million doses, but because we had to change from AstraZeneca to Johnson & Johnson, we couldn't then achieve that. But it's not really that we've lost the time. We haven't really lost the time in terms of the original plan. Phase 1 is 3 months, and the end of 3 months is at the beginning of May. And then the second phase will start from then till the beginning of October. And then the third phase will start from the time of October towards the end of the year. So it was supposed the second phase is 6 months, and we also expect that during that time we'll have quite a number of vaccines coming through. I think from Johnson & Johnson, we should get about 9 million from July to October. We'll get 9 million from them, and then we'll get another 6 million from Pfizer. So they will actually be coming through within that time frame.
Yeah. So let's have a look as well at whether or not, because I'm reading this morning as one of the concerns, and this is brought up by I think it was the DA or other political parties, just talking to the fact that the South African Health Products Regulatory Authority has not even given the Johnson & Johnson vaccine the go-ahead as yet. Is this true?
Well, they've just finalized it. As far as I was concerned, they actually gave that confirmation a day or so ago. But nevertheless, that's not even a problem. The real issue was not whether we would be registered, the SAPA has registered that. The real issue was that Johnson & Johnson was not ready with their batch. They have not released them. They could have got them all manufactured. We went and seen all of these vials. They needed to wait for a month. So that's really the delay. The registration of Johnson & Johnson and Pfizer are just administrative issues which are really not there in place. In fact, the last meeting message I got was that Johnson & Johnson has actually been given its registration. Whether they've received it themselves or that's just been issued, it's something that you can just check. But that's not a problem. The real issue, in Aspen, we went there, we saw all the batches that are being manufactured. They said to us, everything is ready and all the vaccines are ready, except it's a compulsory period of waiting for safety and sterility check. They have to keep them for a month after manufacturing. So they've been manufactured, but nowhere in the world do people have Johnson & Johnson vials. We'll be among the first ones to get them. So there's nothing really that is a delay here. The issue is that we're going according to the manufacturing schedule of the company. So I think we must all just be reassured that everything is still on course.
All right. I hope South Africans feel better about that, but I suppose they will start feeling better when we start seeing particularly elderly people are also being included in this, because there's a lot of worry. And again, some people writing into us just saying, what happens with the elderly people that can't even get to some of these vaccination sites? Now, we've already heard, and I know I've asked this question before, that a lot of the times some of the medical professionals will sit for a few hours before they get vaccinated, but they're fit, they're healthy, they're able to do so. I know it's not as big as what it will be when we eventually start the massive rollout, but for those that actually can't get to these sites, for those that are over 60, they have comorbidities, are plans in place? Are people trained to deal with this? Is this something that is happening behind the scenes? And this training, is it happening so that we can be rest assured that it will go smoothly and that we will get to the numbers of seeing hundreds of thousands vaccinated a day? That's the promise that we've been made from government, that we will eventually get to that stage where we will be administering on a large scale. Are these plans in place?
On the elderly, you're absolutely correct. They've actually done an analysis. The old age from 60 and above and from 40 to 60 is actually a much more serious factor in the mortality that we've seen if you analyze the figures. So we have actually decided it's going to be very, very important to focus on the elderly. And we're dealing with people in various streams. So we're going to be focusing on the elderly in the environment where they are, where you've got old age homes, when you've also got people who are coming to hospital for treatment. We're going to be focusing on those over 60 immediately, and then we also have to deal with those in the occupational health settings at work, as well as in the community. So yes, the elderly have to be among the first ones. In fact, once we finish those who are over 60, and we've calculated the whole country's got close to 5.5 million who are over 60 years. And that's because of the focus we have to put into that. Then we have to also now prioritize those who are above 40. Because when we looked at the mortality, we realized that mortality started rising at 40 years, so those need to be protected as well. Even from workplace and from the community and so on, they need to be protected as the next area of priority. So our plans are in place. We have actually trained a number of vaccinators. We have a discussion now with the private sector so that we split the doses between public and private. And we're also wanting to make sure that, civil society formations, the churches and NGOs work with us in giving the information to the public so that the public knows what we're focusing on at this particular time. But people have been trained. We want to really push it up to a point where we're able to do several 100,000 of people being vaccinated today. Obviously, we hope that the vaccines will be coming at the speed that's going to maintain that high level of vaccination.
And there is a real concern. I mean, we're running in the news this morning about France going into their third lockdown. We're seeing a lot of countries in Europe, unfortunately, seeing the trajectory going higher. I mean, an example such as Chile, which is actually quite frightening as well, is that they're in the middle of their vaccination process. In fact, they've done pretty well when it comes to the number of people that have actually been vaccinated, and yet they're going back into a big lockdown because the virus is spreading once again at a very, very fast rate. So, as much as we are dependent on the vaccine, there is still a lot of a behavioral issue that is at stake here. We're seeing the Easter weekend coming up. We're seeing that restrictions are not very strong this weekend. They're really not. I think a lot of people are very happy that we could still actually go into our religious places of worship and go and pray in larger numbers than we expected. Restaurants are open, taverns are open. But the reality is that even if there is a vaccination rollout, we're seeing countries still buckling. Brazil, burying people at night. Their death toll is reaching proportions they never believed. This is a reality that, unfortunately, South Africa, are you worried we may also be going into something like that?
I think that's important for us to understand that the behavior of the virus is the same in all the countries. The fact that we have started vaccination does not stop the third wave. In different countries, there are vaccinations going into millions of people, but nevertheless, they're still getting the virus going on rampage. So it's important for us to be able to balance the use of vaccines on the one side, but also continue to do use of mass distancing, avoiding overcrowded places, open up ventilation, and so on. So those are the issues that are going to be important for us to say. We're not going to say because we started vaccination, that's the end of the mask and distancing and so on. We have to keep to those. The restrictions have really been in appreciation of the fact that our numbers are a bit low. We need to be cautious during this week. And I think the President has made the point very clearly. The religious sector did carry the country throughout last year. We do understand it's a very sensitive time, but we appreciate the work they've done to help us to save the country from a disaster. But we hope that now we've learned lessons to ensure that the church services, however limited they will be, they must actually be strong distancing to avoid super spread activities. Then we can delay the third wave as far as possible, but it will come at some point. As we are going on with the vaccines, we can't say it can stop the third wave. We need to vaccinate as many people as possible before we can reduce the risk of the infection.
Finally, Minister, I need to let you go, and I know that we've stolen the 7 o'clock news, but I think this is a very important issue. The private sector, they want to get involved. They want to assist with the rollout. They want to get their hands dirty, to try and bring up the numbers, to make this faster, to assist government in any way. I mean, I remember I just happened to be on Discovery Health. I received something from Discovery Health also saying that they got plans in place to ensure that all the members are vaccinated. They want to start on a mass vaccination program. I know a lot of other health service providers are wanting to do that. Corporates are wanting to assist with their employees as well. There is a lot of help at hand. And yet it appears government still wants to go at this alone. What are the developments there? Are there plans in place to make this rollout something that is shared and that the private sector can get involved?
Actually, private sector is involved, and it is not true that this is government. And so the issue is that we have a team that works between us, both from the private sector and public sector, working together to streamline the program. So there are a number of things that we're trying to clear between us and the private sector, and we will continue to do so. But when the vaccines come, they'll be split. Some will go to the private sector, others will go to the public sector, and we will all be vaccinating at the same time.
All right. Minister, let's leave it there. Sorry, just again, the final, you had said that the herd immunity was pushed later. It was hopefully going to be the end of this year, but you said during your parliamentary briefings that it would be more around February 2022. Is that still the aim for herd immunity?
Well, the completion, because we didn't start in January, we still started late in February, we have to push it towards the early part of 2022. That is the completion of the vaccination program. What you get by herd immunity is something that will be assessed at that point. We're working on a guide of 40 million people, but then by that time we'll have vaccinated as many of those as possible, and then we should be able to get a sense whether the risk of infection is still high and whether we've achieved herd immunity.
Minister, thank you for your time. Thanks so much for talking to us here this morning, and I hope that some viewers got value out of that, just hearing a little bit more about the vaccination rollout, our aims, the involvement of the private sector, the elderly healthcare workers, and how things are going to go forward. But the reality is we still need to take care of ourselves.